As younger kids are beginning to get vaccinated, the Michigan Department of Health and Human Services held a virtual event today for parents.
And this included information on why the vaccines are so important here in Michigan, as well as some of the practical aspects of the rollout. Dr. Frank McGeorge joins us now with what parents need to know. Doc?
Yeah, guys, the vaccine for 5 to 11-year-olds were pre-ordered and delivered in anticipation of yesterday's CDC green light. Now the decision to vaccinate or not is in the hands of parents. So today's MDHHS panel really focused on providing some of the information that parents might need to make that call.
In having conversations with my medical colleagues, the vast majority of physicians are planning to vaccinate our own children. I'm planning to vaccinate my son as soon as I can. And I think that speaks to the safety and efficacy of these vaccines.
That's Dr. Natasha Bagdasarian, the new chief medical executive for the state of Michigan. She addressed many of the commonest questions about this newly authorized vaccine, including what's known about potential long-term effects.
What I can tell you is that in the clinical trials in the 5 to 11-year-old age group, the side effects were very mild. And while we don't have long-term data on the vaccines and any potential long-term consequences, we also don't have long-term data on the consequences of COVID-19 infection long-term. The virus simply has not been around long enough, nor have the vaccines.
Other panelists, including Veronica McNally, a member of the CDC's advisory panel on immunization practices, focused on the reason vaccinating children in our state can have an important impact.
In Michigan, more than 196,000 confirmed cases from ages 0 to 19 have been reported, and 22 deaths have been reported in ages 10 to 19 as of October 28th. Outbreak investigations have demonstrated that children can efficiently transmit COVID-19, including transmission to their friends and classmates, their older household members, and community members.
So on the benefit side of the vaccine, whether you are considering the 91% efficacy against symptomatic COVID or the opportunity to disrupt the spread of the virus within a classroom or the community, there are plenty of reasons the vaccine for 5 to 11-year-olds just makes sense.